And so they don't tell us quite why they commit suicide. And in some cases, they may leave a note, or family members may say that they were. What I can tell you is we had a few of those that we know were domestic related, where fellas are weak and they kill themselves because they were having issues with their females.
When it comes to his weak man comments, it's difficult for me to take him to task, because honestly, does the average Bahamian think about topics like mental health and suicide at all? And before I say something dumb, I thought it would be best to ask a professional. Sorry, 1 second. Let me just get a chair. So, we have with us Dr. E.
Hi, everybody.
All right, so Dr. E, can you tell us what it is that you do?
I'm a licensed marriage and family therapist. So I see clients from all ages, from 6 to over 70, on different issues: depression, anxiety, couples counseling.
I'm glad you brought up depression. As you know, the Commissioner of Police said some things this week, and a lot of people have questions on depression and what exactly it is and how can it be addressed. I have a couple of suggestions from the Bahamian public, ways to handle depression. All right, you can just tell me yes or no if these make sense to you, okay?
Okay.
1, you tell them to stop being sad all the time.
Don't do that.
Okay. Drugs and alcohol.
Stay away from those.
All right. What if you just ignore it?
It won't go away.
Pray it away?
Jesus comes to those who help themselves.
What if I firmly tell them to man up, regardless of their gender?
Well, I never knew that manning up would cause depression to go away, but I guess it's worth a try.
What if we just say it like in a firm voice, like a very loud voice?
No, I still don't think that works very well.
So what should a person do if they know somebody who's struggling with depression, or they themselves are struggling with depression? What should be done?
They should first develop a strong support network. They should try to improve their sleep. If they're not sleeping enough, try to get more sleep. If they're sleeping too little, try to get restful sleep. They should develop good nutrition. They should reduce their stress levels. They should try to keep up with their regular routine as much as possible. Simply as getting outside and taking a walk can all be healthy ways to cope with depression. And when in doubt, always get some professional help. What can cause depression would be some genetic issues, meaning like you have a genetic history of it in your family. You could also have, at different times in a month, especially for women, you could have different levels in your chemicals, which can cause more depressive symptoms. There could have been a traumatic event that has happened in your life, from a car accident to an abusive situation to intimate partner violence. There could also be loss of a loved one or some other loss of event, because we know each person is different and each person's resiliency level is different. It does not look the same in everybody.
If a person needs help inside this area, who and where could they reach out to?
If they're feeling very, very depressed, they can reach out to the suicide hotline, which is 322-2763, or they can call one of the psychological association hotlines as well. They can even reach out to my office, and we will send them in the right way if we can't help them ourselves, because we know everybody needs a little help sometime.
That was very helpful. This is usually people hang up on these calls, but I appreciate you for sticking with us through the entirety of this call.
Thank you so much.